stretch reflexes. Because of its monosynaptic pathway, the inhibition of the stretch reflex is produced by pathways that end with the inhibition of alpha motor neurons, and this is brought by two mechanisms, that is by reciprocal innervation and inverse stretch reflex. Reciprocal innervation: when stretch reflex occurs, the muscle that antagonizes the action of the muscle involved relaxes. That is, when agonist contracts, the antagonist is relaxed. This occurs because of the reciprocal innervation. So here in this reflex, receptor is muscle spindle, afferents are 1A fibers, the center is spinal cord, and efferents are alpha motor neuron to the antagonist muscles. In the spinal cord, a collateral branch from 1A fibers arises. It synapses with the inhibitory interneuron, which is called as Golgi bottle neuron, and that synapses directly on motor neuron supplying the antagonist muscle. The pathway mediating this effect is bisynaptic, so because there are two synapses involved. So this is example of postsynaptic inhibition. Significance of reciprocal innervation is that it ensures the movement of the agonist muscle and is not obstructed by the contraction of the antagonist muscle. So here when the muscle is stretched, okay, so it is going to lead to cause contraction of the agonist muscle, and one of the collateral from afferents, it goes to the interneuron, which is going to inhibit the motor neuron of antagonist muscle, and it leads to the relaxation of the antagonist muscle, and this is called as reciprocal innervation. Inverse stretch reflex, or which is also called as autogenic innervation. As the strength of the stretch increases, the reflex contraction also increases. But after a certain extent, as the strength of the stretch increases, the contraction ends and the muscle relaxes. And this relaxation response to strong stretch is called as inverse stretch reflex. Here, the receptors are Golgi tendon organs, afferents are 1B myelinated nerve fibers, and the center is spinal cord. The 1B fibers end on inhibitory interneurons that in turn end directly on the motor neurons. The efferent here are alpha motor neurons to the muscle fibers. Golgi tendon organ. So this organ consists of a net-like collection of knobby nerve endings among fascicles of a tendon, which is responsible for autogenic innervation. There are 2 to 25 muscle fibers per Golgi tendon organ. And stimulation of these 1B fibers leads to the production of IPSP on motor neurons that supply the same muscle from which the fibers arise. Since Golgi tendon organ are in series with the muscle fibers, they are stimulated by both passive stretch and active contraction of the muscles. The threshold of Golgi tendon organ is low. So this is the structure of the Golgi tendon organ, which is present at the end of the muscle fibers. And when the Golgi tendon organs, they are stretched excessively because of the excessive passive stretching or active contraction of the muscle fiber, the afferent 1B fires, and that is going to act on the goes to the interneurons, where it is going to produce inhibitory neurotransmitter on the same motor neuron, which causes the relaxation of the extrafusal muscle, which is called as inverse stretch reflex or autogenic inhibition, which is again example for bisynaptic reflex. Significance of stretch reflex. It is a protective reflex that prevents the tearing of the muscle by extreme stretch. It is important in maintaining tension during normal muscle activity. It is responsible for clasp knife effect or lengthening reaction. It is a response to a spastic muscle, that is high resting tone, to the stretching or lengthening due to operation of stretch reflex and inverse stretch reflex. When muscles are hypertonic, Moderate stretch produces reflex contraction of the muscle due to stretch reflex, while strong stretch produces muscle relaxation due to the initiation of inverse stretch reflex. For example, if triceps muscles become spastic due to any cause, passive flexion of the elbow meets immediate resistance due to the initiation of the stretch reflex in the triceps muscle. Further, stretch activates the inverse stretch reflex. As a result, the resistance to flexion suddenly collapses and arm flexes. However, continued passive flexion stretches the muscle again and the sequence may be repeated. This sequence of resistance followed by relaxation when a limb is moved passively known as clasp knife rigidity or clasp knife effect because of its resemblance to the closing of a pocket knife. It is also as known as lengthening reaction because it is a response of a spastic muscle